This course will cover our medical benefits offered through the company's benefits plans for the current plan year. These benefits are offered to all regular employees who are considered benefit eligible.
This course will delve into the concept of self-funding as it relates to Brundage Management Company, exploring the implications and benefits of this approach. Additionally, we will examine the various coverage tiers offered through our medical plan, differentiate between urgent care and emergency room services, and introduce our telehealth solution, MD Live. By the end of this course, participants will have a comprehensive understanding of our medical benefits and how to optimize their use. At Brundage Management Company, our medical and dental plans are self-funded. This simply means that Brundage Management Company is the insurance company. We take the employee payroll deductions and the employer monthly contributions and put it into one checking account. All claims that we pay come from this single checking account. This way, we can control the cost on our plan and provide lower premiums to our employees. Please review the sample medical and dental ID card. When requested by your healthcare provider or dentist, please identify your insurance company as Health West administrators. Pharmacies should be informed that our coverage is through BIN-A-Card. Your member ID is printed on the insurance card, and you may also provide your social security number if necessary. Please ensure that your provider submits claims to Health West administrators at the address listed on the back of your insurance card. As some providers may not be familiar with Health West administrators, it is essential to proactively assist them in obtaining the necessary information. If you are seeing a provider for the first time, please notify InsurancePal in advance, providing the provider's name, phone number, and appointment details. This will enable them to ensure your provider has the most up-to-date information. If you have concerns about the accuracy of your benefits quotation, please contact InsurancePal directly while still in the office. It is crucial to be actively involved in managing your medical expenses. For assistance with understanding your benefits and coverage, please reach out to InsurancePal. They are available to support you. Since we are self-funded, our medical plan is a PPO or a preferred provider organization. This means that you have a choice of using either the BMC Custom Network on Tier 1 or the Tier 2 Benefit Network to keep your out-of-pocket costs low. You can also use Tier 3 or all other providers and go to any provider you choose, but this tier will have much higher out-of-pocket costs. The BMC Custom Network provides the lowest copays, the lowest coinsurance percentage, and the lowest deductibles. Since this network of providers is specific to Brundage Management Company, you are an active participant in nominating the providers that you use regularly. If you do not want to change your current provider nor pay out that high copay, then please help us build out the custom network for your area. We rely on you to tell us the preferred hospital and preferred doctors in your area, especially if you are in a small town. Use the provider request form to nominate your preferred providers. Please be aware that your provider must be willing to accept our discount for services to be part of our network. Not all providers are willing to do this. It is important that if you nominate a provider, you must let your provider know and encourage him or her to sign our contract. It can take anywhere from 6 weeks to 6 months or more for your provider to review and sign our contract. It is up to how responsive they are. Our Tier 2 or mid-level benefit offers another in-network option for our employees. Because this network is larger than the BMC Custom Network, there are low copays. Even though this tier has slightly higher out-of-pocket costs, these costs are very reasonable. The all other providers on Tier 3 consists of all providers that are not in either Tier 1 or Tier 2. This tier consists of out-of-network providers, and therefore the lowest benefits will apply, and the cost will affect your out-of-pocket expenses. In this tier, you must meet your deductible first before the 50% coverage begins. This tier has the highest out-of-pocket expenses, and in fact, it may feel like you have no insurance at all. Again, we encourage our employees to stay with Tier 1 or Tier 2 to receive the best benefits possible.
Let's proceed with a review of your Brundage Management Company medical plan benefits. This overview will highlight the key aspects of your coverage, although a detailed analysis of every benefit is beyond the scope of this presentation. Please note that your coverage becomes effective on the first day of the month following 60 days of service, provided you are a new employee. If you are an existing employee, your coverage will commence on the first day of the new plan period, unless a qualifying life event occurs, in which case your start date may vary. To be eligible for coverage, you must work a minimum of 30 hours per week. Next, we will examine the Brundage Management Company medical benefit rates for the forthcoming plan year.
Listed here are our semi-monthly medical benefit rates for the timeframe of August 1st, 2026 and July 31st, 2027. Emergency room or urgent care? Choosing the best place to go when you have a sudden illness or injury after hours, when your doctor's practice is closed, can be challenging. Do you go to the local urgent care clinic if it is closer, or if your condition is not life-threatening? Or should you head for the nearest hospital emergency room? Knowing where to go for treatment requires a basic understanding of the medical services urgent care centers and emergency rooms provide. It is important to know where to go when you are dealing with an illness or injury. Let us look at the difference between an urgent care center, both in-person and telehealth, and an emergency room to help you choose the right care. What do you do if you have a sudden illness or injury and your primary care office is closed? If you need medical attention, but it is not an emergency or life-threatening, you have options. An urgent care center provides quality care like an ER, as well as shorter wait times, extended hours, covering evenings and weekends, and care from a doctor or nurse. Our plan covers all urgent care centers with a $15 copay. Work with InsurancePal to make sure the urgent care center near you is aware of our plan. An urgent care center provides quality care like an ER and can save you hundreds of dollars. Urgent care centers also offer shorter wait times, extended hours, and care from a doctor or nurse practitioner. One study found that 90% of urgent care patients wait 30 minutes or less to see a provider, and 84% of urgent care patients are in and out within an hour. Emergency rooms have an average visit time of 4.5 hours. You also can look at the following savings. Your copay for an urgent care visit is only $15, $485 cheaper than your $500 emergency room copay. Urgent care is not a substitute for a primary care physician. You should always consult your primary care doctor for care and treatment recommendations. In addition to going to an urgent care center, you can also use our new telehealth benefit, MD Live. MD Live is a $0 copay choice for virtual appointments with urgent care and mental health providers. Not having to take off work makes MD Live a great urgent care option when you are not feeling well. In addition to urgent care, MD Live offers unlimited mental health counseling. If your illness or injury is severe and life-threatening, then you need to go to the emergency room. If your illness or injury is a medical emergency, you need to go to the nearest emergency room or call 911. Emergency rooms typically treat sudden numbness or weakness, disorientation or difficulty speaking, sudden dizziness or loss of coordination, seizures or loss of consciousness, shortness of breath or severe asthma attack, head injury or trauma, severe cuts or burns, heart attack, chest pain or chest pressure, overdose, uncontrolled bleeding, coughing or vomiting blood, severe allergic reactions. These are just examples of when you need to visit an emergency room or call 911. This is not an all-inclusive list. You may feel that the best choice for your condition is to go to the ER. You should be aware that our plan no longer pays for non-emergency medical conditions treated in an emergency room. Non-emergency care received at an ER will be denied by HealthWest administrators and therefore not paid. When you receive a denied claim from HealthWest administrators, you will have the choice to appeal against the decision. You must contact Insurance Pal to get the appeal process started. Thank you for watching. Please continue to the acknowledgement. Once you have completed the acknowledgement, select the Exit Course button to receive your well-deserved credit.